Hi everybody, thank you so much to the PREACH Association, the Psychedelics for Research, Entrepreneurs, Academics, Advocates, and Curious Humans for inviting me to do a short video description of my advocacy and research in psychedelics space. My name is Sergio Mora. I'm a senior scientist and a stem cell senior scientist with over 15 years of experience in stem cell research. And I focus my career in studying stem cells from different perspectives. My main research interests are focused on biological mechanisms controlling the cell fate of stem cells and the cellular transitions over the process of differentiation. Over my career, over the years of research in my career, I have been focusing in developing novel protocols for pancreatic differentiation. So I have been studying type 1, type 2 diabetes and pancreatic cancer. And especially I developed novel systems to model that disease and in addition to do drug discovery. So the topic of my speech in here is focused on cannabis applications in diabetes and colorectal cancer, and I'm gonna talk about that specifically about case studies that comes from myself personally and also family members. I discovered cannabis long time ago as a medicine. My mom, she was diagnosed of pancreatic cancer, and in her last stages of her life, we apply cannabidiol oil to her just to remove the inflammation and the pain, and really helped her. So I could find that cannabis is a really good medicine to alleviate the pain and suffering of patients with that disease. And in addition to that, my father, he was diagnosed 5 years ago of colorectal cancer. He survived. He still grows cannabis at home, and he uses that medicine to treat his colorectal cancer. We discovered that suppositories of cannabis, full spectrum, administered for over 6 months, could, in addition to radiotherapy and chemotherapy, could shrink the size of the colorectal cysts. And right now he's a survivor. But in addition to that, I found from early on that cannabis is helping me personally to control my blood glucose. I'm a type 1 diabetic patient, and I found that low levels of cannabis can reduce the stress and anxiety, and by chance reducing the levels of cortisol, epinephrine, and adrenaline could regulate the actions of insulin in the body. In other words, has a role reducing the insulin resistance. Some papers describe that, but from my personal experience, I know it really works in the regulation of the blood glucose and reducing the consumption of insulin in the type 1 diabetic patients like I am. Colorectal cancer from my father was a very nice experience because he's a survivor, and also I believe the cannabis actions not only has an anti-cancer drug, also in the regulation of the anxiety and the levels of those hormones could play an important role in the progression of the cancer. Finally, to not extending my talk for a long period of time, I would like to talk a little bit from personal experience with microdosing with psilocybin plus CBD, cannabidiol, a paradigm for the serotonin receptor 2A and 1A. On my personal experience, the microdosing of psilocybin and cannabidiol in small doses has an important action by regulating the anxiety, and in addition, that regulation in anxiety and hormone levels plays an important role in the blood glucose control. So that is the topic that I would like to explain in that speech. Thank you so much for the team for inviting me to perform this talk, and I'm wishing all the best to the people that use psychedelics. Thank you.